I read the most amazing eye-opening YouTube comment and I read, out of high school, I knew I was going to be a doctor. 5 years later, I'm a writer and a correctional officer. Life is so strange. And you know what? That couldn't be closer to the truth. Life changes, you change, you never know where you'll be in a few years. And so I thought I'd give you guys 3 points to think about when deciding whether medicine and being a doctor is right for you. Number 1, medical school and being a doctor, it's not so great. I think it's glorified to us at a young age. You get told, oh, being a doctor is amazing. You get to save so many lives. But let me tell you something. There's nothing amazing about being shouted at down the phone by a patient because you refuse to give them benzodiazepines because they were exhibiting drug-seeking behavior. There's nothing great about the parents of a patient crying, screaming, and hitting you because you failed to save their child, their baby. There's nothing great about being overworked, underpaid, and undervalued by the media and people. And as a medical student, oh my days, exams, they have no chill. They will break you down. They will crush you. It doesn't matter how many A stars at GCSEs or A levels you have, you can very easily fail a medical school exam or sit below average. And how do I know that? And so as well as the imposter syndrome, there's just such an immense pressure to pass and do well in your exams. Otherwise, you can get kicked out of medical school. And so the point I'm trying to make is, it's not all sunshine and rainbows. You have to be prepared to face these hardships at medical school and as being a doctor. Point number 2, that being said, just because there's some aspects you find tough or you don't like, it doesn't mean that it's not for you. If you fail a medical school exam, don't think that you're not good enough to become a doctor. And just because you may not enjoy a particular topic or a particular placement, don't think that you'll hate every other aspect of being a doctor. Because overall, you may find it fulfilling. And personally, despite the hardships, I do find it fulfilling. Going into a hospital ward and talking to a patient, not just talking to them, but actually finding out their deep personal life story, and then using that to help to aid them into finding a treatment for them or curing them from their illness. That is such an amazing thing to be able to do. And so if you like talking to people, connecting to them, and helping people when they're most vulnerable, then medicine might be for you. Point number 3, versatility. People think that you have to be a certain type of person to become a doctor, but with its vast amount of specialities, it encompasses so many different personalities. You don't like people? Then just become a radiologist. You like to deal with children? Then just become a pediatrician. You like cutting stuff, you like blood, and you like quick fixes? Then become a surgeon. Not only that, but within medical school, you may get the opportunity to do something called intercalation, which allows you to spend a year studying and earning a degree in something that can be completely different, such as medicine or law, business, maths, computing science. Shout out, Naj. So that can help you to expand on your skills and help you to do something completely different. And even without spending an extra year studying something else, just medical school in itself, the amount of skills you actually develop and the people that you may meet may allow you to branch off and do something completely different. I remember last year talking to a GP and they said they knew someone who graduated from medical school and then became an accountant. Do you guys know how sick a medical degree looks? Do you know you're a doctor? You know a doctor? It's not just a thirst trap or something to use to convince people to marry you. No, you can use it for so many different things and you will develop so many skills at medical schools that will be able to translate to a lot of other jobs and professions. For example, GP partners, as well as treating patients and talking to patients, a lot of what they're doing is actually managing a business. So if you're into business, then that might be something for you. Don't feel like you're limited to a hospital ward. The world is in your hand. And if at the end of the day you decide that medicine is not for you, then that's fine. You know, I think there's this notion common in aspiring medical students, you know, if it's not medicine, then it's nothing. But really, there's absolutely everything and anything out there for you to do. The world is big, man. You know, I was speaking to a buddy of mine called Safwan. He's got a YouTube channel as well, check him out. And he is currently working a job that didn't exist 10 years ago. And that shows you how many sort of different jobs and how many new jobs there will be in the future. So at the end of the day, find your passion and make that into work or a business. Because as soon as your job doesn't feel like work, then that's how you know you made it. Guys, next video I'm gonna be uploading very soon. It's gonna be exposing medical school. So make sure you subscribe to catch that one. And make sure you click this video as well. I don't know what it is, but it will be a video. Thank you guys for watching. Hope you enjoyed, and I'll see you guys next Taha Tuesday. Peace.